From anatomy to anesthesiology, from pathology to pharmacology, from microbiology to medicine, a one-man resource to the world of health sciences. Welcome to Dr. Paul's Medical Lectures. A practicing physician, Dr. Paul offers you essential insights on diseases afflicting millions of people around the world. For today's lecture, here is Dr. Paul.
This is Dr. Paul. Thank you very much for tuning to our channel once again today. Today I want to talk a few minutes about eosinophilic esophagitis. You see, the name says so much about this condition. Eosinophilic esophagitis, that is the inflammation of the esophagus due to the eosinophilic proliferation. And as this inflammation increases, the esophagus develops rings, and we call it trachealization of the esophagus. Now, let me start with the basic concepts. Most of the times, the patients are young adults. So you will get an young adult patient complaining of heartburn, food impaction, and almost they complain of symptoms similar to acid reflux. So eosinophilic esophagitis is the inflammatory allergic condition of the esophagus. They complain of food impaction, heartburn. It is most commonly seen in young adults. The condition is not well understood at this point, but many patients who have food allergies will also develop this condition. So remember that one point very, very importantly. It is the patient is an young adult who reports food impaction and heartburn. Now the major challenge is to differentiate this condition from gastroesophageal reflux disease, and we can do that only by diagnostic studies. You can do an upper endoscopy, take biopsies from the esophagus, and observe those biopsies. If you see lot of eosinophilic proliferation in the squamous epithelium, then that is eosinophilic esophagitis. And also in advanced stages, you see the rings inside the esophagus when the patient develops eosinophilic esophagitis. That's why we call this condition as corrugated esophagus or feline esophagus, because you see feline means cat. In cat's esophagus we see ring-like structures. So in patients with eosinophilic esophagitis you see those rings, and we call it a feline esophagus or corrugated esophagus or trachealated esophagus, because it looks like trachea. So that's about basic pathology. Now, taking the biopsy is very, very important, because you cannot, in many cases, the esophagus is just normal. It just looks like as a normal esophagus. So you need to take the biopsy and look into the biopsy specimen for eosinophilic proliferation. So that's a very, very important thing. And also, if you see any association between the skin allergies or food allergies, then you need to do the skin testing in this patient, because some patients with allergies to fish and meat and whatever it is, there may be this association with food allergy. That's why dietary modification is an important part of the treatment. So that's about diagnosis. Now, coming to the treatment of eosinophilic esophagitis, there are three things. Number one, because this is an allergic condition, you can go with corticosteroids. You see, we use corticosteroids in asthma. Why? Because it's an allergic condition. Similarly, eosinophilic esophagitis is considered to be an allergic condition. That's why we use corticosteroids like budesonide or fluticasone to treat these patients. Secondly, proton pump inhibitors. They are shown to be effective. because of acid reduction, even though that's not the fundamental mechanism in terms of pathology in this condition. The other thing is mechanical dilation. You dilate the esophagus because the esophagus, it has now these rings all around, and it narrows the esophagus. So you dilate the esophagus, and that's an important part of the treatment. So eosinophilic esophagitis can cause severe pain in many patients. And medical therapy, as I said, you can start with acid inhibition medication, and many patients, they have even reflux associated with eosinophilic esophagitis. That's why when you use proton pump inhibitors like omeprazole, these patients develop a lot of symptom relief, because proton pump inhibitors, they are the first line of therapy. There are alternative medical therapies. As I said, you can target that inflammation with steroids, corticosteroids. Like you can start with fluticasone, and that's a commonly used steroid that in these patients. So start with proton pump inhibitors, then steroids, and other things like montelukast or anti-interleukin, such as anti-interleukin 5. Or you can also go for other things like, as I said, mechanical dilation. So these three are things. Remember, proton pump inhibitors, corticosteroids, and mechanical dilation, these three. And when you treat these patients with corticosteroids, they run the risk of getting yeast infections. So always keep an eye on yeast infections in these patients. And the other thing is, because this is an allergic condition, you can also use antihistamines like loratadine. They also proven to be helpful. So basically, that's about eosinophilic esophagitis. The name says so many things about this condition. It's the inflammation of the esophagus due to the proliferation of eosinophils. The diagnosis, before that the symptoms: an young adult patient complaining of food impaction, acid reflux, and heartburn. Diagnosis: esophagoduodenoscopy. Look for the esophageal rings, and then take the biopsy. Look for eosinophilic proliferation in the squamous epithelium. And coming to the treatment: proton pump inhibitors, corticosteroids, and mechanical dilation. There are so many people suffering with these conditions. Always think about this condition. If you see a patient who is not getting improvement on normal things, or if you are trying to look for GERD, gastroesophageal reflux disease, and you took the pH of the esophagus and the pH is normal, and the patient is still having symptoms, always think of eosinophilic esophagitis and treat these patients accordingly. That's about eosinophilic esophagitis. If you have any important points, please feel free to post them on our website. Thank you.
Thanks for listening. For more medical videos, please visit us at www.drpaul.org and take time to browse through hundreds of health videos we regularly post on our site. If you are preparing for USMLE, PLAB, and other medical exams, make sure you visit our website to browse through our videos explaining the essential points you need to know before taking these examinations. For more information, visit us at www.drpaul.org. Thank you, and may God richly bless you. Are you preparing for USMLE? Please do not waste thousands of dollars on training courses. Get the books written by Dr. Paul with the student-to-student tips and memory aids. The success will be yours, and you will soon realize your dream of becoming a physician in the United States. If you are preparing for Step 2 clinical skills, study USMLE Smasher, a guide helping thousands of medical students to pass this examination. For more information, visit us at www.drpaul.org.